So what I'm going to have you do is introduce yourself. You're one of those people a lot of people need in their lives. And what you do is just so unique. So I want you to just really share a little bit about the work you do and who you are actually.
Absolutely. So I'm Brad Wolgast. I'm in Media, Pennsylvania, where I operate out of the Center for Healthy Sleep. And I am a sleep psychologist. So people tell you, like, what do you do? Like, I treat people primarily for insomnia and for nightmare disorder. But I do a lot of stuff. I trained as a general practitioner, as a therapist, and that's how I started. And I did that for many years. But I've always been passionate about sleep. I've read everything I could get my hands on about sleep since about 1988. And which means, like, I have all this information up here, and I finally found a way to use that, which was this board certification in behavioral sleep medicine, which allows me to practice as the DBSM you see after my name. Everybody's like, what are those letters? So I'm a diplomat of behavior sleep medicine, which primarily leads me to treating insomnia. I also treat a lot of nightmare disorder folks. And, I'm a unicorn. There are more of us every year, but it's such a small group to treat such a big problem in the United States and worldwide, honestly.
Yeah, I mean, the prevalence of insomnia, it's just really out of this world. And it's getting more because there's just so much, the mental health and all those things.
Yeah.
But how does one become a board certified sleep medicine, behavioral sleep medicine specialist? What does that entail?
So first, you have to be a licensed practitioner of some kind of mental health,
Mhm.
or behavioral health or health. So you can be a physician and do it too. Most of us are in the mental health field, so there are some social workers. Most of us are psychologists, and it means you're licensed, so you're already able to practice fully on your own. But then beyond that, you have to have an extra bit of training, a lot of specific training related to sleep, the medicines, but also a lot of the behavioral and the circadian rhythms related to sleep and sleep disorders. And then I did this sort of on my own because I was a lot older than most of the people who get trained for this. I came at it late. I found someone to supervise me, Phil German at the University of Pennsylvania, who's fantastic. He
Hi,
supervised
Phil.
me.
You're
Hi,
working there.
Phil, if you're out there.
He's
um,
awesome.
he's fantastic. So he trained me and he did supervision with me while I met specifically with sleep related clients for the course of about a year and a half. You have to get a certain number of training hours and then clinical hours working with people with supervision from someone who's already got the behavior sleep medicine distinction. And then you take this test, which is brutal. I won't sugarcoat it for anybody, but it's a great, it's a gatekeeper, it's a marker that you know what you're talking about, because this is probably the hardest test I ever took. And that's what I thought when I took the psychology licensure test. It was also a very hard test. So it's several layers of different kinds of training and practice and experience to get to that level, to get those letters after your name. And then after you get the letters, you have to keep getting training. Every 2 years, they assess you to make sure you're getting enough training to maintain that distinction.
That's amazing. So let's talk about insomnia because I feel like this is one thing, and I mean, I would love to talk about nightmare. Maybe now this is a sign I'm probably going to have you back again. But
Aha.
let's focus on insomnia, right? And I want you to tell us what is insomnia, because that's also a term that has been used so loosely. People mix it up with sleep deprivation. There's just so much that is unclear out there. So walk us through what that is and who really meets the criteria.
Yeah, I love the question because you're right. It's so misunderstood. And it's kind of a very loose term. Insomnia just means not sleeping, and that's not good enough, right? We need to do better than that. So when we do this diagnostically and clinically, what we're looking at is how how they're doing when they're trying to sleep. Are they sleeping? Are they not sleeping? And then what's the effect of that on their life? So it needs to be, we talk about the rule of threes. So, and this is a very low bar, at least 30 minutes per night, at least 3 nights a week for at least 3 months. And then you've got a distinction of being, a chronic insomnia problem. Now, most of my clients hear those numbers and they're like, that is ridiculous. I haven't slept that well in decades. Let me tell you what my insomnia is like. So what we typically see clinically, and I know you see the same thing, are people who suffer trying to sleep but unable to sleep for hours, either at the beginning of the night or during the middle of the night, or just waking up way too early. Or if they're really good at it, they can do all of those, right? They can just have a mess of a night. It's the effort of trying to sleep and being unable to do that, as well as having enough time available to sleep. So you're not just trying to cram it all into 3 or 4 hours. You have 6, 7, 8 hours, and you're still not sleeping well during that time.
Mhm.
I can
That
I can go more, but I think we're there, right? Okay.
and I think that is very succinct and exactly the thing. There has to be adequate sleep opportunity. I think this is where people miss it, where they say, well, I work 2 shifts. I'm in bed at
Mhm.
5 p.m. Sorry, I'm in bed at 1 a.m. and I wake up at 6 and I'm so tired, maybe I have insomnia. And it's really that sleep opportunity piece is important. And I think we're definitely going to talk a little bit about how you help too, because I think that really ties it up very nicely. So now we understand what insomnia is and what insomnia is not. It's not sleep deprivation, right?
Right.
In fact,
Right.
a
Yeah,
lot of people with insomnia give themselves a lot too much sleep opportunity, you know?
exactly. And CBT-I, and I know we'll talk more about that in a minute.
Yeah.
CBT-I really focuses on that because one of the first knee-jerk reactions, if you have a bad night or 2 bad nights in a row, is, oh, well, I'm going to go to bed early and I'm going to catch up. And for some people that works, great, good for you. But for many people, and the people that you and I meet, it doesn't work. They go to bed early and then they lay awake longer because now they have more chance to not sleep. And that gets them worried and upset. And this is the cycle that starts. It becomes a dog chasing its tail where they start thinking about, I can't sleep. Tomorrow's going to be terrible. I'm going to get sick. People are going to notice. I'm going to fall asleep in that meeting. And guess what? There's nothing worse for falling asleep than worrying that you're not going to sleep and everything's going to be terrible. You do that long enough, and now you're starting to worry about heart disease, dementia. I'm going to have a stroke because I can't sleep. And I've read the studies. I keep seeing, you know what I mean? So you know what I mean. It becomes this sort of out of control worry. The more you worry, the harder it is to sleep. So
Mm.
that's the C in CBTI, is getting in there and sort of pulling out these distorted thoughts about what's going to happen and how bad your sleep is, sort of helping them settle and mellow and giving yourself new ways to think about your sleep and approaching sleep so that it isn't, your thoughts aren't pushing sleep away.
Yeah, thank you. I loved what you just said. Thoughts pushing sleep away. I feel like this is what I tell some of my very type A, driven women that I see in my practice who struggle with sleep. Of all the things you can micromanage and control,
Yes. I know where you're going. Yep.
sleep is just not one of them. And the harder you try, the more it eludes you. And I love that. So what I wanted us to even talk about is this, right? This is 100%. I still had 2 patients yesterday who talked about this, and even actually a clinician, very well meaning clinician, who was sending a patient to me and said, listen, I've done all the things. I tried CBT-I for them and it didn't work. And I said, wait, what's going on? And also, I've had patients say, I've already done CBT-I, it didn't work. And then I
Mhm.
start getting to the details and I'm hearing, well, I turn off my phone, my house is dark, my room is cold, I don't scroll on TikTok. And so now we take what is just so incredible. You have spent, so many years of your life really dedicated to doing, and we've now minimized it into this whole concept of sleep hygiene. So I want us to even talk through the two, but we're also going to connect this to really sleep hygiene is important. Don't get us wrong, but they're two entirely different things. So maybe just walk us through that.
Yeah. Wow. That is a big playing field. So I'm gonna play a little bit, but feel free to bring me back.
Yeah, I'll
I've
knock
heard
yourself out.
I've heard you say this analogy before on this show. So some of your listeners may have heard this because I love it, and I've used this too. With care for your teeth, right? You need to take care with dental hygiene. You need to see your dentist every couple of times a year. And you need to do things like floss, you need to brush, you need to use good toothpaste and good toothbrush. That's just the basics, right? That's every day. That's hygiene. That's dental hygiene. Sleep hygiene is the same. You need to keep the basics. You need to do the things that make sleep more likely to happen. But when you have a problem, like a cavity in your teeth, you can't just fix that with flossing and brushing, right? You need to go to the dentist and have the cavity filled. With something like a sleep disorder, whether that's insomnia, a narcolepsy, apnea, something else, you're going to need help. You're going to need help to take it back and get to a place where you're sleeping well again. And it's not just hygiene. So, and another little thing I like to tell my clients is, if I give you a sleep hygiene handout, because we all got them.
Oh yeah.
I know very well, because there's research on this that shows, I hand you a sleep hygiene handout, you go home, and how much improvement is there in your sleep? Zero. There's none, because you know all this stuff. Everybody knows basic sleep hygiene, and most people know it to a level that's pretty darn good. Pretty much you got it. You know what you're doing. So the problems people are having with sleep are almost never related to sleep hygiene. And yes, we can pinch and pull and fix things a little bit. And that's helpful, because that's the building blocks, that's the basics. And if everything else is good and you don't have a sleep disorder or insomnia, that may be great. That may be all you need. Most of the people I see and that you see, they may have problems with those building blocks, even though they know they're supposed to be doing them. They're sort of doing them sideways, or they do them for 5 minutes and then stop.
Yeah.
But beyond that, treatment for something like insomnia means going much further than just, are the blinds closed, and is it dark in your room? Is it cool in your room? And do you have comfortable pajamas? All those things are nice, and they are helpful for getting sleep to show up, but they are not enough to overcome something that you have built as like an insomnia disorder.
Yeah. So good. So good. Again, don't get us wrong. This is something we have to, because again, you're right. Like, I've seen patients who have had chronic insomnia, and maybe they did some of the sleep hygiene initially, and now it's out the window. So we still say, okay, what are you doing? I mean, the likelihood that you're going to get incredible sleep if someone's out there playing like some rock and roll and there's
Right.
bright like overhead lights,
Yep.
that kind of thing. So there's always a balance. So talk us through, now we've had that patient who is like, okay, we've established relatively healthy habits. We've done all the things, right? We're the ones that are taking everything. We have a, 20 list long bedtime routine filled with sleep hygiene tips and things like that. And it's not working. And now they're having performance anxiety. What is cognitive behavioral therapy for insomnia?
Right. And I like to call what you just described the house of cards, right? I have my tea at this time, and I do my yoga at this time, and I have this and this and this and this. And if everything's done just right, then I'll have a good night of sleep.
Yeah.
And the joke is, you ask somebody who sleeps well, what do you need to put together to have a good night of sleep? And they say, I just lay down in bed and then I fall asleep. So to take what you said, my answer to your question is, what we do together in CBT-I is we start to take down the house of cards, and we start to let sleep just show up and be something that happens because your body desires it. You have a drive to sleep. So sleep it's a born in drive, just like hunger and thirst. And that's a really good way to think about it. The more you go without it, the stronger the drive gets to have more of it. The same way you get thirsty when you're hot and when you're exercising, or when it's just been a long time since you had a drink, you get thirsty. Same with sleep. So cognitive behavioral therapy for insomnia means, the C means taking down the ways that you're thinking that are getting in the way and pushing sleep away. The B is behavioral, and that's a lot of the card removals. You don't have to have anything. You don't even have to have a mattress to get good sleep. Quite honestly, all you need is to let yourself get tired enough and exhausted enough. You will sleep, and you'll sleep better than you probably sleep now with a comfortable mattress, if you let yourself get that tired. Now, don't get me wrong, I'm not making my clients sleep without a mattress. I'm hearing myself talk and I'm like, don't no one's ever going to call me again because he's telling you to sleep on the floor. That's not what I mean.
Yeah.
What I mean is, if you make yourself your body desiring sleep so strongly, it will not matter how many things you put in the way. Your body will start to take over and say, I need sleep. So one of the ways we do that, we talked earlier about sleep opportunity and people tending to add way too many hours to their night so that they're laying in bed awake literally half the night. One of the things that we do in CBT-I is we shrink the opportunity to sleep so that it's becomes more precious, so that your body starts to say, oh my God, I don't have 10 hours in bed anymore. I only have 6.5 or 7. I better start using it. And I'm not talking about thinking, I'm talking about your brain back here saying, whoa, I got to have my sleep. I need it back. And that's one of the big, powerful, I mean, truly a powerhouse of CBT-I. We call it sleep compression. Sleep restriction is another word. Compression sounds a lot nicer, and that's generally what I use. They're a little bit different, but they're very similar ideas. And it's like pulling that opportunity to sleep tighter so that your body starts to desire it more.
That's powerful. Now, so we talked about cognitive, behavioral. What are the behavioral part, including sleep compression? What are some of the other aspects of CBT-I that you worked with?
Well, before we get too deep into things like compression and things like that, we're always starting with a sleep diary. So we're keeping track of how that's going every day with some very basic but pretty important aspects of what people are doing. I'm teaching them relaxation strategies and breathing strategies. That's part of the behavioral, but also part of the cognitive work. So teaching you how to calm your body, teaching you how to remove the thoughts from your brain that are going to sort of push sleep away. And then we're going to lean into, what does your sleep diary tell me about your sleep opportunity and what's happening during the night? One of the things, the other pieces that I love, and I've done a lot of work with college students who usually I've only had sleep insomnia for a few months, so we don't need to go all the way down the road to compression, is stimulus control techniques for insomnia. And these are tried and true. They're as old as I am. The guy who wrote this stuff up wrote it in the late 60s, early 70s. Oh, I just said my age. But it's brilliant and it's very simple. And I was just working on this today in this room. It means and this has slipped into sleep hygiene, but it truly is about cleaning up your bed and your bedroom and making it more of where your brain expects to sleep. So with college students, you think about a dorm room, what do they do in bed? Everything. They eat in bed, they do homework in bed, they hang out in bed, they're on the phone, they're texting, they're watching shows, they're sleeping sometimes too. So this old part of your brain, when you get in bed, it doesn't know what to do there. Like, are we eating? Are we gonna watch TV? Or are we gonna hang out? Or maybe we're gonna sleep. The simpler it is for your brain to know what happens when you're in that space, the easier it is for you to get some sleep. So the first thing is, make your bed for sleep and only sleep. That's stimulus control. You hear that in sleep hygiene now, but it started with this. And that's especially true for people with insomnia. And this is the hard part for my clients and yours too. It's the middle of the night, it's 2 in the morning, it's 10 degrees outside, right? You're not sleeping. The best thing you can do after 20 minutes is get out of bed. Go do something quiet and calm somewhere else. And after about half an hour, come back to bed and try again. That's a huge powerhouse hit for insomnia too, because, and I'll shut up in a minute, I swear. I know I'm getting long. It does two things. It breaks that connection between sleep being a place to lay awake and be frustrated and annoyed. It breaks that. But it also, when you're laying awake in bed at 2 in the morning, remember that sleep drive I keep talking about. The stronger it is, the easier it is to sleep. If you're laying awake in bed, it kind of hovers. It doesn't get stronger, it doesn't get weaker. But the problem is, the longer you lay there, the more likely you're going to dip into stage 1 sleep and probably out again and in and out and in and out. That can actually weaken your sleep drive. making it actually harder for you to fall back asleep. If you get up and go sit in a chair somewhere else, that doesn't happen. It's a lot less likely, and your sleep drive gets stronger. So you broke the connection, but you also got your sleep drive stronger. Then you get back in bed after half an hour. You may not fall right back asleep, but that drive is where you want it, and it's going to keep growing. So those are the big features of CBT-I. And you and I both, we get clients all the time who are like, oh yeah, I tried that. I went to somebody, and you hear them and you're like, that's not
Nah, no, it's not. And the reason why I really wanted you to highlight this, Brad, is y'all see, I talk about this all day, every day, right? But now we're hearing from a behavioral sleep medicine specialist. So this is so critical to understand. And I feel like just give yourself the opportunity to think maybe there's more, right? And this is, Brad, he didn't really fully give his age, but you can imagine this is like years of practice, right? Doing this over and over again. This is well researched. This is our go-to, our first line treatment for insomnia. Medications are a bridge. They were not, and none of the studies have looked at medication long term. I have patients who have been on various Ambien, different medications, clonazepam, all of that for decades. There's no end in sight. That was not what these medications were designed for. So if you can harness and own these tools, that then, because life will life, right? You will have seasons where things would be challenging, but imagine having the tools to say, okay, I know exactly what I need to do to reinforce my sleep drive, to relax myself, to get out of the way so sleep can come. These become the tools that are going to help you. And what I love, like you said, is college students. So you don't have to, you don't have to wait until this has been going on for decades. You can actually start to, especially we're talking if you're lucky enough and find yourself a great specialist within the 3 months of having insomnia. That's great. But no matter how far down in your journey you've been, you could get the help you need. No matter how recently these symptoms started, you can actually get in and get this help so that it doesn't become something that becomes chronic. So I really appreciate you sharing this.
Absolutely. Yeah. And you're so right. I love when people come to me and it's only been 3 or 4 or 5 months, because we can whip that into shape and we can kick that out and get you back to sleeping the way your body wants to sleep.
Yeah, absolutely. So let's shift gears a little bit. You wrote a book, it turns out.
Yes, I did.
Out in the middle of March. And I just think, again, this is why I wanted you to come and just share, number one, your wisdom. And really, I wanted my audience to learn from you and really learn about how this is and how, as much as we love to talk about, the basics of sleep hygiene, all of that, to help you understand that there are things that we may need to do to kick things up a notch. But what I love, the gold medal sleep, I mean, I cannot wait to get my copy. But tell us a little bit about the why behind writing this book and what in the world is it about? Why should everybody head off to Amazon to pick their copy?
Yeah, please do. Gold medal sleep comes from the idea it's truly for everyone. This is not a book to treat a disorder, but it kind of comes from what you were saying. I speak to a lot of groups. I train a lot of mental health providers on sleep. And when I'm done, they usually say, do you have a book? Do you have something I can read later on to remember this stuff? And I haven't. I started writing things down and this is a great tip. Eventually I had 30 pages and then I had 75 and then I had 150. I'm like, I think I have a book. So what I turned it into is, how do you make sense of sleep in the modern world that we live in, right? It's the circadian rhythms that are built for us as human beings to operate off of the sun and the darkness don't get the best information anymore because we have lights everywhere all the time and we have screens that are full of incredible information. So the book turned into, how do you engage your sleep and your health in a way that will make you live better? And it's the things I tell my clients all the time. Like everybody talks about screen time and all of that, but I really dig down into what is it about screens that makes them problematic for sleep? because I mean, I use screens too, but I don't
Mm,
have trouble with sleep because I use them in a way that makes my life healthier and it makes my
mm,
sleep better and healthier too. There's a
mm,
lot of like high level, mid level, and through tips that really help people from morning to night. And it's gold medal sleep because in the Olympics, you know, here we are in 2026. I really work with my clients every day on picking their goalpost. You know,
mm,
this may be a really stretch goal for you, even though you're not going to be trying to do much compared to a lot of people. Let's put that at bronze, and a bronze medal is amazing. Love it.
mm.
And silver is a little bit harder, and a gold may be what you're really striving for, and you've got the time and the opportunity to do it. Let's lean into gold. That's great. And the best part is every day, every night is a new opportunity for
Yeah.
metal, right? Because we sleep every night. So the idea is you pick your own adventure a little bit. You choose how you want to approach this, from screen time to caffeine use to changing how you approach uh, dinner and meals in the evening and snacking, as well as, and in particular, about using sunlight and evening time for darkness and quiet to help you
Mm.
prepare and have good sleep and circadian rhythms.
Oh, I love all of that. One of the things I just want, if you guys, I mean, we've talked and covered so you, I mean, you've dropped so many gems, Brad. This is amazing. One of the things I talk about too is this: your good sleep, gold medal sleep, restful sleep is not what happens at 10 p.m. when you're getting into bed. Good sleep, high quality sleep, restful sleep starts the moment you wake up, no matter how bad the
That's
previous
right.
night is.
That's right.
You get up and your feet hit the floor, exposure to light, like you said, what
Yes.
you're eating, your mental capacity, what your caffeine intake, alcohol, all those things are setting you up for good sleep the following night. So I love that you've put all that in a book,
Yeah.
because then it makes it such that we're not just going hitting Google up and saying, hey, show me what are the top things. And there's the science behind your wisdom and things like that. So
Right.
this is incredible. When does it come out? Where do we find it? How can we get hands on it ASAP?
Yeah, please. It's going to be on Amazon. It'll also be, I'll have a website called goldmedalsleep.com, which will have some information on there too. You can order it off of my website, coming out mid-March, and
Mm.
it'll be on, you know, the paperback. You can get it digital for your Kindle. And then coming in the summer will be the audio version. You'll get to hear my voice. It's hard for me to listen to my voice, but other people apparently think it's okay. So that'll be in June, I believe. It'll be coming out on Audible. So looking forward to all that.
Yay, that is so exciting. Congratulations. I know what it takes to
Yeah,
put a
you
book.
do. Your book was terrific as well. Thank you.
Thank you, because it's, but I feel like it's, again, it's a legacy. It's, this is what I want to gift the world. This
Right.
is, this is years of experience, years of wisdom that is impactful, right? And there's so much. I know you're busy, like we've talked about before. Your clinic is constantly full, but you cannot see. There's a limit to the number of patients. Even if you saw patients every single hour of the day, well, not every single, maybe 16 hours, because you're going to go to sleep for 8 hours, whatever, right? But
Mhm.
now there's a book that people can start to work on, and then at least ensure that they've set themselves up for sleep success. And then from there, be able to move on to say, okay, done that, been there, what next? And so I think this is just beautiful. So where can people find you? So we know we will find the
Mhm.
book on Gold Medal Sleep. Where, if people are like, okay, I got it now. Everything I've
Yeah,
been doing was sleep hygiene. Now I'm really ready to get into the real deal and, get me some CBT-I going. Where can people find you?
absolutely. If they're looking for treatment or if they're looking for me to come do a talking,
Oh,
speaking engagement, whatever, Center for Healthy Sleep has a website that is helpmesleep.com. It's just that simple. And then on Instagram, I'm at Center for Healthy Sleep. So you can find me there.
amazing, amazing. And I put it there. We'll put it in the notes. We'll put the
Perfect.
link to your book and all of that. Any last words for that person who has had years of or months of sleepless nights and they are tired of being tired? What would you say to them? And they
There,
have no, they feel like they don't have any more hope. Like maybe I'll never be able to sleep again.
that's what I was going to say. There is hope. but there is hope. Even when it feels like there isn't hope, when it feels like you've tried everything out there, you've read everything, you've talked to your doctor, you are listening to two people right now who love this work, who do this work, and we know other people too. If you're not in our area or if you can't get on, we can help you find someone out there who does what we do. And there is a way through this. And it may be a lot more complicated than what it sounded like I was talking about, depending on all the things, but there is still hope because
Mm,
your body really, really wants to sleep at the end of the
yeah.
day, even if it feels like it doesn't.
Mm, that's such a powerful way to end. Your body knows and wants to sleep. It knows what it needs to do. It wants to sleep. And so having the right tools, creating the right environment condition, and there's help out there.
Yeah.
um the nighttime googling, let's be done with it. Reach out for help. And whether it's Brad, I know you're licensed in like multiple states, which is amazing because of the PSYPACT. So
Yep.
y'all just head over to his website, helpmesleep.com. I think that would be a great place to, what do you think? That would
That
be a
sounds
great.
great. Yeah, I'm PSYPACT approved in like 40 states, and I just learned Guam is now on the list. So now the time difference might be difficult if you're in Guam listening to this, but we'll figure something out.
Oh, that's amazing. That's amazing. And you guys know where to find me, the restfulsleepmd.com, or call our office. Always, always more than happy to help. This is why I love having conversations like this, because the goal is to empower you so you can take the next step. And that next step may be to pick up a phone and call, or to go online and schedule that initial consultation. We're here for you. We're more than happy to help. And until next time, I hope you rest well. Thank you so much, Brad, for coming. I'm so thankful.
That was great. I love being here. This was terrific. I really enjoyed it. So, and your questions were great, very helpful. And I know I can get long-winded, but you get me
No,
going.
you did awesome. All right, everyone. Take care.
Thank you.